Hey, good afternoon and welcome to the Bidders Conference for Childcare Health Consultation Systems Development for Best Starts for Kids. This is focused on our prenatal to 5 services. Thank you so much for taking the time to join. My name is Jessica Cafferty and I'm the Program Manager for Childcare Health Consultation at Best Starts for Kids. I'll also be joined by my colleague Sarah J. Sanford from our Data and Evaluation team. Just a couple housekeeping items. We have about an hour or so together today. We will have some time dedicated at the very end of the presentation for a Q&A. Right now I have all participants muted. At the end, I will unmute you, and you're welcome then to unmute yourself on your end. You'll have to take that step in order for me to hear you. So we'll have some dedicated time to ask questions then, but if you have questions as we move through the presentation, feel free to ask them in the chat box. We'll be reading those aloud and answering those questions as we go as well. So we're going to go over a few items today. We have, again, about an hour together, and we'll be doing an overview of Best Starts for Kids as a whole initiative. We'll review some of the key elements of this RFP, and then we'll have, as I mentioned, a time for dedicated Q&A. Again, please feel free to type answers throughout the webinar, and as I review the key elements of the RFP, I'll let you know which section of the RFP we're going over so that you can follow along. So Best Starts for Kids' vision is fairly simple and also pretty comprehensive. We want to see more babies born healthy, more kids thrive, and more young people grow up to be happy, healthy, and successful adults. It is the most comprehensive approach towards this work in the nation. We're dedicating about $65 million a year towards this work, and we'll go into some more detail about those allocations in just a minute. One thing that's really critical to recognize about Best Starts for Kids is that we are using equity and social justice as a foundation for all of our investments and all of our work. And what that really means is that we recognize the persistent inequities that exist. We know that there are a lot of data points that point to really high quality of life in King County, and that is just not the full story for many folks. And that especially by race and place, we know that things are getting worse for some folks and really threatening our collective prosperity. So to fix that, we're working on investing in organizations that are reflective of and embedded in their communities, as well as those that recognize both the disparities and disproportionalities, as well as the strengths and ingenuity that communities possess. Oops, that's it. So how do we do it? We have 4 main ways that we do this work. The first is promotion, and that's through really increasing the positive things that we think about for young kids and families. So things like access to resources, positive and healthy attachment and relationships, and opportunities available. The second is through prevention. So that's reducing the bad, things like chronic and toxic stress, unsafe environments, or insufficient access to resources and opportunities. Early intervention is our third component, and that's when problems are identified to get kiddos and families the resources and supports they need quickly and efficiently. And the last one is policies and systems change, and that really refers to the fact that we know for this work to have an impact beyond the lifespan of BSK that we're going to have to focus on making the case for investment in kids and families, and also recognizing what's going well and where we can do better. So I referred to that $65 million a year allocation earlier. We have that divided in 4 main areas, and this was informed by a deep community outreach effort. We talked to 2,000 community members in King County, and that directly shaped how we allocated these funds. So 50%, the largest bucket, is going towards investing early. That's that prenatal to 5 that this RFP falls into. 35% of levy investments go towards sustaining the gain, and so that's investments in youth 5 to 24. We have a healthy communities investment area. You may have seen some really cool work that's happening in our communities of opportunity area. That's 10% of our funding. And then data and evaluation. We are really trying to use this as an opportunity to learn more about the work that we do around kids and families and community. And so we're dedicating 5% of the levy to doing data and evaluation. So now that we've done a review of Best Starts for Kids, we're going to move into talking specifically about this RFP. So this is section 2 of the RFP if you're following along. Childcare health consultation is a strategy that really promotes the health and development of kiddos, families, and childcare staff. It's done through usually a team of consultants who provide tailored consultation, training, and support to childcare providers. And that can really be everything from support around behavioral health needs to prevention of disease outbreaks to emergency preparedness. It's really all of their needs, and providing that assistance on an ongoing basis in sort of implementing the changes that they can to improve health and safety of kids. This work has been delivered by Public Health of Seattle-King County for over 30 years. It exists across the country, and Washington State is actually one of the only states that doesn't have a cohesive system of this work. So we're hoping to expand that. And this strategy, this RFP specifically is around the systems development work. So I want to call out that we do have another RFP open. We'll talk a little bit about it in just a moment that is focused on the service delivery, but this work again is focused on systems development. So it's eligible, folks are eligible if they are not-for-profit organizations, CBOs, tribes or tribal organizations, schools or government agencies. We are also opening this RFP to private consultants or research organizations. And I want to call out that we're very open to the idea of partnerships and collaborations. And as always with BSK, small nonprofits and community-based organizations are highly encouraged to submit proposals. So I mentioned that we have another RFP currently out. That's our service delivery RFP. That allows folks to choose one of two options for building teams of consultants. They'll either follow our public health model, and that's teams delivering a more traditional model of childcare health consultation that's informed by Public Health Seattle-King County. They'll have at least a nurse and a mental health consultant. But we're also investing pretty significantly in community-informed models. And so those will be really innovative pilots to deliver consultation in a way that is culturally and linguistically appropriate and or is very community specific. So I want to just highlight that these are areas that we're also investing through BSK and areas that the agency funded through this RFP will be working closely with. Agencies may apply for both RFPs in separate applications. So for this RFP focused on systems development, we have $250,000 annually available to support childcare health consultation systems development work in King County. The contract period is up to a 3-year contract. We're hoping to have contracts begin on May 15th of this year. And we're asking for organizations, again, to request no more than $250,000 a year. We are planning to only award one lead agency. Again, partnerships and collaborations are encouraged, but we'll be making one award. So I want to go over some of the goals that we have for the systems development RFP. We have 3 main goals that we think about. So the first is that we really want to develop an accessible system through which the different entities that are offering childcare health consultation, which include Public Health of Seattle-King County, private nurses, and the BSK-funded organizations that will be awarded in May, a system through which they are connected, supported, well-trained, and working cohesively with a focus on both addressing unmet need and alleviating those race and place-based inequities that we talked about. The second goal is that we want to partner with someone who can identify opportunities to align with and provide strategic direction on statewide efforts. So that could be efforts like Healthiest Next Generation, quality improvement systems, as well as licensing requirements. And have that agency explore partnerships and opportunities to really build on the work happening at BSK and make the case for a statewide system. The last main goal we have is to map childcare health consultation's role in early childhood health and to build relationships and collaborative efforts with other key stakeholders to integrate that system, the childcare health system, within broader early learning, health, and Help Me Grow system. So I wanted to also go over our funding priorities. These are in alignment with King County's Equity and Social Justice Ordinance, and they're prioritized in our implementation plan for Best Starts for Kids. We are really trying to prioritize organizations and agencies that serve communities contending with disparities and disproportionalities and or limited resources and service gaps. So our 2 main funding priorities for this strategy area are organizations embedded in communities of color, immigrant and refugee communities, low-income communities, communities, communities with disabilities, and or limited English-speaking communities. We also want to partner with organizations that work with community-based organizations serving diverse communities. So that to us means employing both staff and leadership representative of the communities served, and having a consistent and regular process for seeking community input on needs and services. So I'm going to pass it over to my colleague, Sarah J., who's going to share a little bit about data and evaluation, and then I'll be back to wrap up our presentation.
Thank you, Jessica. I'm pleased to be here and share a little bit of information about data and evaluation today. I'm going to start with some tips about using data in your proposal, and then tell you a little bit about what you can expect about evaluation. So we have 3 guiding values that we hope you'll see reflected in your work with our data and evaluation team, which are partnership, collaboration, and accessibility. So with that in mind, let's talk a little bit about using data in your application if you choose to submit a proposal. We recommend thinking through your story, and what we mean by that is what is the narrative that will help you show the strengths and the needs in the communities that you'll be serving if selected for this RFP, as well as the strengths and assets that your organization will uniquely bring to this work. There's a lot of data out there. I'll show you just a tiny little bit of it today, but your time will be best spent and probably the outcome will be most compelling if you think about what information will really be relevant to your story and then go out looking for it. Because it's easy to get overwhelmed, whether you love data and you follow through the kind of data click hole, or you get overwhelmed because it's not as fun for you. We recommend these steps kind of in this order to just help guide your search a little bit. So when we think about what data is, numbers is something that often is the first thing to pop into mind, and that is absolutely something you might want to consider for your proposal. I'll show you some of the quantitative data that we're making available through Best Starts for Kids. But that's not the only kind of data that we value or that will be compelling to reviewers. You're welcome to use stories, photographs, or even videos if you think it will really help tell the story of what communities are experiencing and what you'll bring to this work. Here's an example. When we had an outbreak of lice last month, I knew who to call. My nurse consultant helped me take the steps to stop it from spreading and get our center clean and safe. Her visits are making me feel more empowered and confident in my ability to provide high quality care for all of our kids. I think this is a great story because it's really, visceral as a reader. When I think about that, if I was in that position, I'd be so grateful to have access to quality childcare health consultation to help respond to a lice outbreak. So think creatively when you think about what kind of data will help tell your story. All right, we have a few things that are included. If you've had a chance to look through the RFP, I know it just came out this morning, but you will see some links to different data sources, and those really are there because we want our information to be accessible and for everybody who might be interested in looking at it to know that it's there. It's not there because you're required to use it, and it's not there because it'll be valued more highly than data from other sources, such as your own programmatic data or data from community members. So that really is there for accessibility and transparency, and we do encourage you to think broadly about what kind of data you might have. You might have, in addition to stories, you might have some quantitative data from other programs you've run that are relevant that show your track record of success, things like that. So think creatively, and with that in mind, I am going to take a minute to show you our Best Starts for Kids indicators page. We're really excited to be able to share all of this data with communities, but it's not always intuitive to navigate, so I find it helpful to just take a moment to actually look at it. So if you choose to explore this data on your own, hopefully you'll know where you're going with it. So I have my lovely colleague helping us take a look at this here. So if there's any little delays on our end, that's why. So we have this page. You'll see it linked in the RFP. It's the Best Starts for Kids indicators, and this really is the big picture numbers that we think will help us know how we're doing on the issues that impact the health of children and families in King County. So it's not something that any one program or necessarily even one strategy area is going to fix, but it's that big picture that we keep our eye on to see how is King County doing and hopefully how is Best Starts for Kids making an impact. And if you scroll down, you'll see a pretty lengthy list of these indicators. If you'd like, you can choose to explore them by the indicators that we've selected for different age groups or for homelessness prevention or our communities of opportunities partnership. But let's take a look here. Let's click at developmental screening, if you see that there. You'll see we have some interactive visualizations built out for most of these. And they can help you drill down into regional or racial and ethnic differences that communities are experiencing in King County. So when you first come, you'll get a little bit of text that explains what is it that you're looking at, and usually on the first page, a map. So here we see the different colors of blue. There are indeed different rates of access to developmental screening in different parts of King County, but overall it's pretty low, even in the best places. So if we go ahead and take a look at the demographics tab at the very top, here you'll get to see different breakdowns in addition to just geographic. So what you'll see depends a little bit on the data source. We're trying to share as much data as we can, but it depends on where we get that information, what kind of demographic categories that we're able to use. So here you can see it's broken down by gender, race and ethnicity. In this case, we have more detailed groups for race and ethnicity as well, because we know that for many communities, having just one big overall category doesn't tell the whole story. We've got it broken down by income, by region, language spoken at home, and then some other socioeconomic indicators like the parents' education. Is that on there? Thanks again to my colleague who's helping us look through this as we run the webinar. So again, what you'll see on that demographics tab is not the same, unfortunately, for every indicator, but if you are looking to see what the needs are, what the strengths are, or what disparities might be experienced by different communities, it's a great place to start. So we also, you can check out custom demographics if you want to try to drill down further. You can choose two different groups to look at. So instead of just looking at race and geography, if you see those two drop-down menus, you can choose, for example, race, ethnicity, and let's see, let's do race, ethnicity, and region. And you'll see more data being suppressed because the numbers do get smaller when we look in a different category. But here, if you're wondering, are there differences in what Latinos are experiencing around developmental screening for their kiddos in different regions? We can see that there are some differences. So that's kind of a next step if you've exhausted the other tabs. But if you are looking for more specific information, the custom demographics tab can be a great way to find that. So let's go back to the indicator page for a moment. And I just want to show you real quick, scrolling down, if we search in the search box, you will see that there is some data here for different measures of quality childcare. So let's search for childcare and see what comes up. We've got affordability, adequately staffed, spending the right amount of time on important activities, and so this might be particularly indicators that are of interest to you for this RFP. So let's go back. I want to just check and see if there are any questions about this. Please feel free to go ahead and type them in to the chat box. I know there's been some noise from our neighbors in the next meeting room over here, so we apologize for that. But if you do have questions, let me know. We'll answer them as we go along, as well as at the end. I'm not seeing any now, so I'll keep going. We can go to the next slide. This just shows some of the different indicators that you will find on that website. And then moving on to evaluation. If you've taken a look at the RFP, then you might know you don't have to submit an evaluation plan. That's not because evaluation isn't important to us. as Jessica described, it really is, but we'll be working with the selected partner to collaboratively develop an evaluation plan. You don't need to sink your time and energy into that as you prepare your proposal at this point. Although if you have ideas that you're excited about, you can certainly include that as well. In addition to the indicators that we're looking at, all the programs we work with will have different performance measures, and that'll all be decided collaboratively between the selected partner, the program manager, Jessica, and somebody from our data and evaluation team. And Jessica will talk a little bit more about some budget outlines, just to show that we know that the partner that we choose is going to be prepared to work with us on evaluation. Again, don't need to include any plans in your RFP at this point. So with that, I'm going to hand it back to Jessica.
Thanks, Sarah J. Great, so we're going to move into some contractor requirements. This is section 4 of the RFP if you're following along. And there are a couple of requirements that we build in for all of the contractors through BSK. So the first is that we have a number of BSK trainings, and we ask for contractors to hold time essentially for participation in up to 3 annual events. So that can include things like an orientation to BSK, a focus on professional development, data use, and systems building. The second piece I want to highlight is the integration of BSK priorities. This is something that we're doing throughout our prenatal to 5 work, and that is, it's 4 separate areas that we're asking folks to build in some time for. So this contractor will work in partnership with King County to integrate these priorities. That includes things like Help Me Grow. It's a system that exists nationally that we're now building out in King County to essentially connect families with the services and resources that they need, as well as connecting BSK-funded organizations and other resources to one another so that we have some really streamlined systems of support. The second is that we are working towards universal developmental screening for all kiddos in King County. That's something that certainly as a systems development agency, we'll be looking for your help in thinking about how we can integrate that work through Child Care Health Consultation. The third is Vroom. For those of you that aren't familiar with Vroom, it's a really great tool that's based on brain science in a way that is really accessible for parents and families and teachers, essentially to help sort of kids develop doing the daily things that you're already doing, like laundry and dishwashing. So we'll be looking for some support in thinking about how we can push Vroom out into the community. The last thing is toxics. We do have a focus here on reducing toxics exposure for kids. They're so much more likely to be exposed to toxics because they're putting things in their mouths and crawling around, and so it has a very different effect on them. Things like lead, exposure to other chemicals, and so we'll be asking folks to think about how we can spread information about toxics and work towards reducing exposure to those in King County. The timeline is in section 5 of your RFP if you're following along. This RFP came out last Thursday on February 1st, and we are just doing one webinar, but this will be posted to the BSK blog for folks who aren't able to attend and that want to observe. You're also able to ask questions. So on the RFP, there is an email address, cpres-bsk@kingcounty.gov. You're able to ask any questions to that address all the way through March 2nd. The reason that we have that cutoff is because we document all of those so that folks can have those answers publicly available. And we'll release those in an addenda on March 5th. That'll be posted to the same procurement website that you can access that RFP on. We also have technical assistance supports, and we're going to talk a little bit more about those in just a moment. The final day to request initial technical assistance is March 7th, but if you're already working with a TA provider, they'll keep working with you until the very end. And then again, RFP responses are due on March 14th, and we're hoping to begin contracts by May 15th. So for rating criteria, I do encourage you to refer to the rating criteria that are in section 6 of the RFP as you develop your proposal. These are exactly the things that proposals are going to be scored on by our review panel, and so there's nothing that's not already on there. There are 2 primary components. So the first is community needs, fit, and approach. And what that assesses for is a clear understanding of the need for child care health consultation, as well as a really clear plan for your project and how it will will address different different areas of systems development. The second component is organizational experience and capacity. And what we're looking for there is expertise in early learning or health, and a track record of delivering relevant systems development work. We're looking for an ability to plan tasks and engagement of the community. And we're looking for relationships with relevant partners, as well as an understanding of practical and culturally relevant methods for community engagement. So again, you can find more details in section 6, and we highly encourage you to consider all of those as you develop your proposal. If you refer to the RFP, sections 7 and 8 go over the review and appeals process. I'll just say that the review process is essentially conducted by a panel of community members, subject matter experts, King County staff, as well as representatives of council. So they will review those proposals. There is an appeals process. You have 4 days after decisions are made to appeal the decision, and you can refer to the RFP for the full process there. So budget is section 9 of the RFP, and I just want to highlight a few things that are important to think about. All applicants must submit a completed budget, but the budget is not scored. So unlike those rating criteria, this is one that reviewers will look through, but they won't provide a score on it. Be sure to download the budget template from the procurement website. That already has a number of line items that we're looking for, as well as auto formulas to calculate. So don't alter the formulas. Go ahead and use that as your template. We do encourage you to include evaluation costs of up to 10%. Again, we recognize that there is a big lift when it comes to staff time or resources in order to conduct thorough evaluation, and it's really important to us. So we do encourage you to build that in. We also encourage you to build in estimated costs to participate in those BSK required trainings and contractor requirements. A final note, administrative costs should not exceed 12% of your total budget. So technical assistance is a great support that we're offering through Best Starts for Kids. We have a number of TA providers, and they're really there to provide support to organizations and eliminate barriers that might prevent folks from seeking funding. They offer a really wide range of skills, areas of expertise, and language abilities, and they can help in a number of ways. So one of the things they can do is they can help you assist you in determining the fit between your proposal and the RFP. They can provide guidance on how best to answer questions, and they can also support application review, including editing and budget. We do ask a couple things. Please reach out to TA providers as early as possible after the RFP opens. They can often accommodate last-minute requests on an as-needed basis, but they'll be more able to provide a full amount of support and time the sooner that you make your initial request. We ask that you please only contact one TA provider at a time. If for some reason you want to work with another TA provider, you're able to do so. Please just let the first provider know that you're going to be working with someone else. And finally, we welcome applicants' desire to find a cultural and linguistic and personal match. So please feel free to check out the TA providers that we are working with. Again, all of them are a free resource to organizations that are intending to apply, and find someone that is a really good fit to support you. So a few additional resources. If you have questions, please email our contracts office. This is the email right here, and it's also on the cover page of the RFP. It's cpres-bsk, and that's cpres-bsk at kingcounty.gov if there's anyone on the phone. Again, you have access to technical assistance. You contact them directly via email, and Hannah's included the link on this webinar here to the TA providers. You can also find it by going to the BSK blog. The RFP includes a glossary of terms that includes a list of relevant definitions that may be helpful as you develop your proposal. And the final item is please just complete the checklist to make sure your proposal is eligible for review. There are a number of sort of smaller items that are really important for us to be able to fully consider each proposal. So please make sure that you go through that list of items. So that completes our presentation today, and we'd love to answer any questions you may have. I'm going to go ahead and unmute participants, but that doesn't unmute you on your end. So if you want to ask a question, you'll have to unmute on your end as well. Again, we've also got the text box, which I know some of you have been using on this app. So please feel free to ask questions either by unmuting yourself or by typing them in. Great. If there are no questions, we'll go ahead and wrap up. Oh, looks like we've got someone typing a message real quick.
I think that'll be the.
So we have a message here from Adrian. It looks like the focus is on interaction with families rather than childcare providers. Adrian, that's a great question. And actually, I would say probably no. We think of that as sort of the second level of impact, that the first would be childcare health consultants working with providers in order to support kids and families. And so, through this systems development, we imagine that an agency will be working primarily with consultation efforts as well as with childcare providers, but that there will be some element of outreach to kids and families as well. But the focus certainly, at least initially, is on the service delivery being to childcare providers for the benefit of families. Other questions? Great. I'm going to say thank you all so much for taking the time to join us. Again, we'll be posting this webinar for review to the BSK blog, and you are welcome at any time to reach out to our CPRES email address, our contracting office, or to one of our TA providers. Thanks again, and have a wonderful rest of your week.